Welcome to our first educational video. The UCC Latino Geriatric Center Memory Clinic team would like to start providing educational videos to our community regarding various topics related to brain health. Our first topic that we would like to discuss is responding to dementia in the Latino community. This topic will be split into two different videos. Part 1, we will be providing a Dementia 101, and Part 2, we will discuss what the Latino Geriatric Center Memory Clinic is doing specifically in response to dementia in the Latino community. The videos will be provided in both English and Spanish. I want to start off by presenting our memory clinic team. We have Dr. Piero Antuano, who is our bilingual neurologist through Frater and the Medical College of Wisconsin. Ana Bernal, our bilingual registered nurse. Vanessa Anciani, our bilingual social worker. Virginia Serpa, bilingual community outreach coordinator with a Latino focus from the Alzheimer's Association. And Al Castro, the program director from the United Community Center. We're going to start off with Dementia 101. We will be providing some basic understanding regarding the brain and dementias. Our learning objectives for today are as follows. We will learn what is dementia, what is the most common types of dementia, signs and symptoms of Alzheimer's disease, risk factors for dementia, is there treatment for Alzheimer's disease or other related dementias, and why is early detection of cognitive impairment important?
We want to start off by reviewing some statistics regarding Alzheimer's disease and other related dementias to emphasize the importance as to why we need to learn more about this disease. As we will talk later in this presentation, one of the major risk factors for developing Alzheimer's disease is age. 1 out of 10 people over the age of 65 have Alzheimer's disease. Alzheimer's disease is the 6th leading cause of death. 1 in 3 seniors die with Alzheimer's disease or other related dementias, and 2 out of 3 Americans diagnosed with Alzheimer's disease are women. 82% of seniors say it's important to have their thinking or memory checked, but only 16% say they receive regular cognitive assessments. More than 500,000 Americans will develop Alzheimer's disease this year, and half will never be told their diagnosis. One of the barriers that we hear our patients talk to us about is the language and cultural barrier when it comes to completing the neurocognitive screening assessments, and the belief that forgetfulness is a normal part of aging. We will talk more about this later on in this presentation. Also, in our future presentation, when we talk about how the Latino Geriatric Center Memory Clinic is responding to dementia in the Latino community, we will talk specifically about how our memory clinic is the only fully bilingual memory clinic in all of southeastern Wisconsin. Continuing with the statistics, by the year 2050, the cost of Alzheimer's disease to the nation could rise as high as $1.1 trillion. In part due to the rise in people being diagnosed with Alzheimer's disease and other related dementias. Currently, there are about 5.8 million Americans living with Alzheimer's disease, but by the year 2050, this number is projected to rise to nearly 14 million. So why are these statistics important to our community? Hispanics are 1.5 times more likely to have Alzheimer's disease than Caucasians, while African Americans are twice more likely to develop Alzheimer's disease. Hispanics and African Americans have a higher risk of developing diabetes, high blood pressure, and high cholesterol, of which can increase the risk of developing Alzheimer's disease or other related dementias. Also, a study from the University of Wisconsin reported that stressful events equal to 1.5 years of brain aging across all participants. But for African Americans, every stressful event is equal to 4 years of brain aging. For those of you interested more on this topic, I recommend you watch the presentation by Acanthus Farley, licensed clinical social worker of whom works for the Alzheimer's Foundation of America, entitled Aging Through Traumatic Stress, Analyzing the Effects of Traumatic Stress and Race on Alzheimer's Disease. And right here on this slide, you will be able to see the link for that presentation. Let's talk briefly about the brain. The book, The Brain is Kind of a Big Deal by Nick Sullick, summarizes what the brain is and how it communicates with the rest of the body in a very easy and fun way to learn. I bought this book for my kids so that they could learn a little bit more of what I do here at the memory clinic and more about the brain. And it's actually very interesting. I recommend for you guys to buy it. So here we go. Let's read a few pages. Inside of your head, behind your eyes, and under your hair is one of the coolest things about you. Your brain. Your brain is the command center of your entire body, a living computer. It's constantly collecting and storing new information about everything you experience. That way, the next time you experience the same thing, your brain will know exactly what to do. The brain is made up of billions of things called neurons. They talk to one another by sending messages through gaps called synapses. When your brain's neurons work together to help your body take action, you could do all kinds of complicated things. I'm sending you a message. Pass it along.
I'm sending you a message. Pass it along.
Got it! Once a message leaves the brain, it travels through long, stringy nerves. Nerves are like roads. They connect the brain to everything else in the body. I'm getting pumped up just watching this. On the screen, you can see a drawing of the brain on the left. And then the other two pictures in the middle and the right are pictures of healthy neurons. In our brain, we have 10 billion neurons. Those neurons are the only cells in the body that can generate electrical impulses. And those electrical impulses allow us to think, move, perceive, and feel sensations. Remember that neurons communicate with each other by sending messages through things called synapses? Well, here we're able to see a drawing of what those synapses look like. This is how the neurons in your brain work together to help your body act, think, etc. Now, I don't know if you guys ever played the telephone game. Our neurons sort of work similar to what the telephone game is. Now, how do you play the telephone game? The telephone game is where you either sit around in a circle, and you could start with the first player going clockwise or counterclockwise. That person would turn to the person next to them and give them a phrase by only moving their lips or either whispering it very, very softly. And then that person will then have to turn around to the next person and say what they thought that the first person said until it gets to the last person. The last person will then say what they thought they heard was out loud, and then most of the times you'll see that what you started with is not what you end with. Now you can make it a little bit more difficult by having everybody stand up and have each other face each other's back, and then putting headphones on with music, like kind of loudly, so then that way they're not able to hear the person say the word out loud. And how does this kind of compare to each other? How can we compare the telephone game to how our neurons work? Well, the person that starts the game is the neuron that initiates the communication, either from the brain to the rest of the body or from the body to the brain. Then the other players in the middle, those are the neurons that help carry the signal to its final point, which is the last player who could either be the brain or the body. If the person could hear and understand the other person clearly, then the message would reach the endpoint without being distorted. But because the person cannot hear the message well enough because it's either being whispered or it's just the person's just moving their lips, or because you have very loud music on, then the message is going to become distorted. Now, this can also happen with the neurons being affected with their thinking, the behavior, and the feelings. They're being affected either by two proteins that are seen in Alzheimer's, which we'll talk about a little bit further in the slides, or other complications that affect the neurons. Well, now that we have a very basic understanding of the brain and neurons, and we learned a little bit of a fun game, let's talk about dementia. Dementia is caused by damage to brain cells. These damages interfere with the ability of brain cells to communicate with each other. When the brain cells cannot communicate normally, the patient's thinking, behavior, feelings, and their ability to do everyday tasks such as bathing, dressing, eating, etc. can be affected. Dementia is a term used to describe a series of symptoms caused by disorders or diseases that affect the brain. It is not one specific disease. There are many different types of dementias. So what are the different types of dementia? There are many different types of dementia, but we're only going to focus on the most common ones today. The most common type of dementia is Alzheimer's disease, of which accounts for 60 to 80% of people diagnosed with dementia. We will talk about Alzheimer's disease in the later slides. The second most common dementia is vascular dementia, previously known as multi-infarct or post-stroke dementia. With vascular dementia, patients show impaired judgment or ability to plan steps needed to complete a task. This is seen during the initial symptoms as opposed to the memory loss often associated with the initial symptoms of Alzheimer's disease. Vascular dementia occurs because of brain injury such as microscopic bleeding and blood vessel blockage such as strokes. The location of the brain injury determines how the individual's thinking and physical functioning is affected. The third most common dementia is Lewy body dementia, and that accounts for 5 to 10% of people diagnosed with dementia. Patients with Lewy bodies often have memory loss and thinking problems common in Alzheimer's disease, but they're also more likely than people with Alzheimer's to have initial or early symptoms such as sleep disturbances, well-formed visual hallucinations, and muscle rigidity or other Parkinsonian movement features. The fourth most common is mixed dementia. In mixed dementia, abnormalities linked to more than one type of dementia occur at the same time in the brain. For example, a person could start off by having a major stroke, developing vascular dementia, and as they age, later on in the years, they can develop Alzheimer's disease, which is a progressive memory loss. One of the other types of dementia that we will address in a different educational video will be regarding Down syndrome and Alzheimer's disease, as we learned that people with Down syndrome tend to age 8 to 10 years faster than the general population according to research, and according to research, people living with Down syndrome are at higher risk of developing Alzheimer's disease due to genetics. Lastly, I wanted to talk to you about mild cognitive impairment, also known as MCI. MCI causes cognitive changes that are serious enough to be noticed by the individuals experiencing them or by their loved ones, but the changes are not severe enough to interfere with their daily life or independent function. Therefore, a person with MCI does not meet the diagnostic guidelines for dementia. However, those with MCI have increased risk of eventually developing some form of dementia such as Alzheimer's or another type of dementia. However, not all people with MCI get worse and some eventually can get better. So what is Alzheimer's disease? Alzheimer's disease is the most common form of dementia. Alzheimer's disease specifically is a degenerative disease of the brain cells that is caused by abnormal deposits of two proteins. One of the proteins forms plaques in the middle of the nerve cells blocking the signal, and the other protein is found in the nerve cells that are dying or are dead already. Alzheimer's disease causes damage to nerve cells and loss of tissue in the brain, and this causes the brain to shrink dramatically over time. And with the shrinkage of the brain, patients have fewer functioning nerve cells, which can affect their memory, problem-solving, thinking, feelings, and movement. Let's take a look at these pictures. On your left, you're able to see on the bottom a picture of some healthy neurons. Let's explain how those proteins work first. We could start off by seeing our healthy neuron right here. This is the body of that neuron. Then we have what I like to call the little tentacles of the neuron where they receive the information from the other neuron. As you could see happening in this little section over here, this little light, that's kind of like that electrical impulse of those two neurons communicating with each other. Now, the first protein, it's going to affect or it's going to happen in the middle of those tentacles. So imagine that you're kind of creating a door, this blockage. If you're trying to receive a signal from this neuron up and there's a blockage there, it's not going to get to the body of the neuron to effectively communicate with each other. So that neuron is going to be like, I never received the message. What are you talking about? So it's not going to continue on to the rest of the neurons. The second protein occurs in dead or dying nerve cells, and we could see an example of that right here. So if the nerve cell is already dead or dying, it can no longer send any signals and it cannot receive any more signals because it has lost that connection. Now, lastly, we see on this picture to our right, we see what I like to call a highway of neuronal connections. It is a microscopic image of those neural connections that we are talking about. We can see a healthy connection in this area right here where there's no ends of connections like potholes. It's still under construction area. And then here we do see that we're losing some of those connections. We're losing that highway of communication due to those plaques, the tangles, the dead or dying nerve cells. And because they're no longer functioning, we no longer have communication, and that's going to affect our problem solving, our thinking, our feelings, and our movement. Now let's take a look at how Alzheimer's disease affects the brain. Since Alzheimer's disease causes nerve cell damage and tissue loss throughout the brain, this causes the brain to shrink dramatically over time. As we can see in the picture to our left, if you take a brain facing forward and then slice it from the top down, that is what you will be able to see. Now, those are not examples of the same patient, so it's not the whole brain of the same patient. It is one half of one brain of a healthy patient. So we see this side is our patient with our healthy brain, and that's cut towards the middle, cutting up and down if you're facing it forward. And then you have a slice of a brain of a person with severe Alzheimer's disease. Now, can you see the difference between the healthy brain and the brain with severe Alzheimer's disease? Well, we can see that the brain with severe Alzheimer's disease has shrunk due to the loss of tissue. The brain has also lost a lot of those neuronal connections, and all of this is due to the formation of plaques and tangles that prevent those nutrients and other essential supplies from moving freely through the neurons, causing the neuron to die. Again, the loss of tissue and neuronal connections caused by Alzheimer's affects a person's memory, problem-solving skills, thinking, feelings, as well as movement. With Alzheimer's disease, some of the first symptoms you might start to see are trouble remembering recent events, remembering names, remembering the date. There could also be changes in their mood. For example, they could have apathy, which is loss of interest in things they used to enjoy, not showing much enthusiasm. They could show signs of depression. Later symptoms may include impaired judgment, disorientation, confusion, behavioral changes, difficulty speaking, difficulty eating, difficulty swallowing, or walking or other activities of daily living. Now, in the picture to our right, we're able to compare a lateral view of a healthy brain with a brain with severe Alzheimer's disease. On the bottom, we're able to see that the healthy brain is shown kind of lightly towards the back, so that you're able to see the difference in size between the two brains as well.
Some of the risk factors that we cannot control in regards to Alzheimer's disease or other related dementias is age. Age is the greatest risk factor, especially once you reach the age of 65. Family history and genetics is another risk factor that we cannot control. They are both influencing the onset of dementia, and it places the patient at a higher risk of developing Alzheimer's disease. Okay, so let's talk about the risk factors that we can control. There are some risk factors that we can control to maintain a healthy brain. One of those is to maintain our heart healthy by not smoking, maintaining a healthy weight, managing our blood pressure, cholesterol, and blood sugars. We can also exercise for at least 30 minutes a day, 5 days a week. This could include walking, chair exercises. If it seems difficult to do 30 minutes straight, try spacing out the times, for example, breaking it down to 2 15-minute exercises a day. Another thing that we can do is protect our brain from any injury. We can do this by learning to reduce the risk of falls by following the CDC guidelines, such as maintaining proper lighting, taking away any loose throw rugs in the home, making sure your loved one has proper footwear. For the people that are still able to drive, making sure you wear your seatbelt and practicing safe driving. For those still practicing contact sport, wearing helmets while practicing will help. Even wearing your helmet when riding your bicycle. Another thing we can do is limiting of alcohol intake to no more than 1 drink per day. Preferably have that drink be red wine. Receiving adequate sleep by maintaining a consistent bedtime, limiting TV bright light exposure before bed, avoiding caffeine 4 to 6 hours before bedtime, not drinking too many liquids before bed. Managing stress by practicing activities to reduce stress such as yoga and meditation. Nutrition is also very important by focusing on plant-based whole foods and reducing saturated fats and added sugars. We also want to make sure that we maintain mental and social activity by making sure that we challenge our brain by playing games, reading books or articles, trying something new, working on puzzles, music, art. Maintaining social engagement is a very important part because it is associated with living longer and having fewer disabilities. Here are 10 early signs and symptoms of Alzheimer's disease according to the Alzheimer's Association. You do not necessarily have to have all 10 symptoms in order for you to be diagnosed with Alzheimer's disease. You could have one very pronounced symptom, or you could have a combination of more than one. For example, your loved one could have a very pronounced symptom such as memory loss that disrupts daily life, or they could have changes in mood and personality, or a combination of either of them. In the following slides, we'll discuss some of the differences between normal signs of aging and dementia symptoms. So let's talk about normal signs of aging and signs of dementia. Here we have the difference between normal signs and the dementia signs. Some of the normal signs will be sometimes forgetting the right word. Signs of dementia will be trouble having a conversation. I'm going to go over some examples just to give you an idea. For example, you could have somebody that loses things from time to time, but are most of the time are able to retrace their steps. This could be a normal sign of aging. Compared to someone with signs of dementia, the person is misplacing things often and they are unable to find them, and because of this, sometimes they start accusing others of stealing what they lost or misplaced. Another example would be maintaining prior level of social skills. A sign of dementia could be loss of interest in social activities or socially inappropriate behaviors. One normal sign of aging can be may have to pause momentarily to remember the way. Now, the signs of dementia could be they get lost inside of the house, they get lost outside of their home, or may take hours for them to remember where they had to go. Now, let's talk about different types of memory. For the purpose of this presentation, we will only talk about short-term and long-term memory. So you may wonder, why is it that my family member is able to still remember some things, but other things they can't? For example, we had somebody ask us how come her mother was unable to remember if she ate or not, if she took a bath or not, but yet when it's 8 o'clock, she knows that it's time to go to the sofa and get ready to watch her favorite show. Well, the reason being is because there's different types of memory. For example, there is memory associated with emotions that works on a subconscious level. Now, let's talk about long-term memory. This is more related to events from the childhood and from the past. This type of memory decays very little with time. Short-term memory is more of the present active memory. This memory could last seconds. This can be current dates, recent events, etc. Have you ever had an episode where you were doing something, you get up, get to the kitchen or another room in the house and wonder why it was that you went there? Well, that was your short-term memory. Here are some very funny comics regarding memory. But before I forget, another thing we wanted to mention regarding memory is that a person with dementia may not remember what you said to them, but they can remember how you've made them feel.
So Vanessa and I will read to you one of the comics. I will be the brain and Vanessa will be the Yeti. Hey, remember that time when you were a kid and your friend pulled down your shorts in front of the whole class?
Why do you always have such a strong recollection of embarrassing moments? Can't you remember any moments when I was in control of the situation?
Lars, memory are tied strongly to emotions. If you feel embarrassed, I'm more likely to remember embarrassing moments.
Well, I'm not embarrassed now. Why don't you try remembering this? It'll be good practice.
Crack, crunch. Sure, no problem. Okay, so we talked a lot about the condition of Alzheimer's and the different types of dementias, right? We also mentioned beforehand that there are mimicking conditions. There are things that could cause those symptoms that mimic that of dementia or the memory loss, right? The Wisconsin Women's Health Foundation came up with the following acrostic for the mimicking conditions of dementia. D stands for drugs, medications, delirium. E is for eyes and ears and the endocrine dysfunction such as hypothyroidism, diabetes. M is for mental health disorders such as depression, anxiety. E is for excess fluid around the brain. N for nutritional deficiencies such as vitamin B12, vitamin D, folate. T is for tumors, toxicity. I, infections, injury to the head. And then A is for alcohol and sleep apnea. So let's just talk about some of them. For example, let's talk about eyes and ears. If somebody can't hear what you're telling them, how do you expect them to remember what you said? If they have problems with hypothyroidism or diabetes, that is a big issue where we start having problems with memory, where everything is a little bit more slowed down. If we have problems with mental health disorders such as depression and anxiety, a person could be having memory loss due because their mind is so preoccupied with so many things, so many thoughts at the same time. So what happens is, imagine this kind of like the game of the little frog that tries to cross the street, with all those cars running by and trying to get to the little pond. It's kind of like that. The thoughts and the preoccupation that this person has due to the depression and anxiety are those cars going in 1,000,000 miles per hour. And that little frog is that little piece of information that you're trying to get into that long-term memory so that this person is able to remember, or that little pond. Well, sometimes it's kind of difficult when those cars are going really fast for that little frog to go without being splattered all over the place and the person forgetting that information, right? So that's why we want to make sure that if a person does suffer from mental health, that depression, that anxiety, or other mental health problems are being addressed and they're seeking either psychiatry, psychotherapy, or receiving medications for treatment of that, so that we're able to differentiate between memory loss related to mental health or neurocognitive disorders such as Alzheimer's disease, which is a progressive disease. If they have urinary tract infection, they could become more disoriented. They could also become more aggressive. They're not themselves, or they're more lethargic, meaning that they're kind of sleepy all the time, right? Well, once you have them treated with antibiotics and that infection is cleared out, then what happens? They're back to their baseline, right? So that's kind of what we want to look for.
Is there a treatment or cure for Alzheimer's disease or other related dementias? There is no cure for Alzheimer's disease at the moment. There are medications that can be used to help in the management of memory decline, as well as other medications to aid with behavioral component of the disease. Besides medications, there are also social interventions that we can put into place to aid with treatment and improving of the quality of life of the patient. Let's talk about medications as treatment first.
The U.S. Food and Drug Administration has approved 2 types of medications, cholinesterase inhibitors and memantine. The medications are used to treat cognitive symptoms such as memory loss, confusion, and problems with thinking and reasoning associated with Alzheimer's disease. While the current medications cannot stop the damage that Alzheimer's disease causes to the brain, they may help lessen or stabilize the symptoms for a limited time by affecting certain chemicals involved in carrying messages among the nerve cells. Cholinesterase inhibitors help delay the worsening of Alzheimer's disease by preventing acetylcholine from breaking down, of which is important in mood, memory, and learning. Memantine helps improve memory, attention, language, and reasoning. Now, there are other things that we could do. For example, we could manage behaviors via medications, for example, with antidepressants. If the person is depressed or irritable, we could use anti-anxiety medication for patients that are agitated and aggressive. We can also use social interventions that we will discuss in the next slide. Another important thing is before diagnosing that we address and we talk about any mimicking conditions of dementia, and we address the risk factors for Latinos. We mentioned how vascular complications can affect our memory. Our heart health can be compromised by uncontrolled blood pressure, uncontrolled cholesterol, or uncontrolled blood sugar levels. So it is important to manage those coexisting conditions in order to maintain good brain health. And it is also good for medical providers to address any mimicking conditions that could be reversible. And we're talking about mimicking conditions about dementia that we mentioned at the beginning of the presentation, such as problems with their thyroid function, deficiencies in vitamin B12, vitamin D, etc. On the screen is a list of the generic and brand name medications that are used in the treatment of Alzheimer's disease. The most common ones are donepezil, also known as Aricept, and memantine, also known as Namenda. I will not go into detail regarding the medications, as it is always best practice to always consult with your physician regarding your medications or your specialist.
Okay, so let's talk about some of the social interventions. Some of the interventions that we can do in managing of the Alzheimer's disease and our behavior mood changes that do not involve medications are establishing a behavioral support plan. A behavioral support plan assists a patient in building positive behaviors to replace or reduce a challenging, dangerous behavior. The plan can be done by the providers working with the patient, such as primary care physician, a social worker, our psychologist, psychiatrist, and also involve the family member and caregiver. If a person is having a sleep pattern changes, we could start by having a routine established, also making sure that the person doesn't sleep as much during the day so that they can sleep at night. We can do this by giving them coffee, Mountain Dew, so the caffeine can keep them up during the day. They can also attend a day program or senior center to stay active, involved, and socialize with others their age that may share similar interests. Coordinating the patient's plan of care with family and healthcare providers involved in the patient's care. Providing information regarding support groups to family members, respite options, memory cafes. Providing educational opportunities regarding the disease to the family, caregiver, and the patient. Check her physical reasons for agitation such as hunger, thirst, needing to go to the bathroom. They may not be able to let you know what is wrong. Also, exercise can ease anxiety and stress. Find an activity that they enjoy. Keep your emotions in check. This will avoid criticizing or arguing with the patient. Try to create a calm and quiet place. Cut out background noise from TV or radio. Clear away clutter and make tasks simple.
So why is early detection important? From the onset of symptoms of Alzheimer's disease, it could take up to 1 to 2 decades to progress throughout the stages. A person with Alzheimer's disease can live 4 to 8 years after being diagnosed in most cases, but in some cases, they can live as long as 20 years. It all depends on the age and the onset when they were diagnosed, and if they have other health conditions or comorbidities. The reason why early detection is so important is because we want to be able to improve the quality of life of the individual living with Alzheimer's disease by either providing them with medications that may slow down the progression of the disease, by offering additional supports and treatment plans, not only for the patient living with Alzheimer's disease, but also for their loved ones that are caring for them. This will also allow them to have those tough conversations regarding healthcare power of attorneys, burial trust funds, things like that. We want to make sure that everybody over the age of 18 has a healthcare power of attorney in order for us to let other people know, the healthcare providers that are taking care of us, what is it that our wishes are and who do we want to make those decisions for us when we're no longer able to do so. All right, so we have reached the end of Responding to Dementia in the Latino Community, Part 1, Dementia 101. We learned about what dementia is, what are the most common types of dementia, signs and symptoms of Alzheimer's disease, risk factors for dementia, treatment and management of Alzheimer's disease and other related dementias, as well as why it is important that there's early detection of cognitive impairment. During our Part 2 session, we will be discussing how the Latino Geriatric Center Memory Clinic is specifically responding to dementia in the Latino community by providing information regarding diagnosis process of the Alzheimer's disease and other related dementias, providing an overview about the Latino Geriatric Center Memory Clinic, understanding the eligibility and referral process to the Memory Clinic, as well as providing information regarding the Latino Geriatric Center community resources. I hope this video was beneficial and informative, and please stay tuned for our Spanish version of Dementia 101, as well as other upcoming educational videos that will be available to our community in both English and Spanish. Thank you so much for joining us today.
For more information, contact Ana Bernal, nurse at 414-649-2805 or Vanessa Anciani, social worker at 414-649-2808.